So now I want to transition a little bit and talk about how we can kind of solve this problem and what specifically each of you are doing to kind of make an impact on the healthcare industry. So if you can maybe tell the audience a little bit about what problem you identified in the healthcare industry and how you went about trying to resolve that problem by starting your own company and how your company kind of plugs into part of the solution.
As equal as it is troubling, we're definitely trying to solve the issue of diversity, medicinal research diversity, because that also leads to standard of care. Whenever if I go into a hospital or go to a doctor's office and say, I'm suffering from acute shortness of breath, and I may have lung cancer, they'll kind of scrutinize my feelings before someone else's. And then because I'm a kind of a subject matter expert in that area myself, so I would know when I would have certain conditions. It wouldn't be the same for a patient who is not cognizant of any medical condition or medical terms, specifically if they have a familiar history of lung cancer. And it has shown that groups of diverse descent does have continuous evolution of diseases within the same oncology space than others, than our European American counterparts. So what we want to be able to show and understand is that, listen, the standard of care should be the same or even better, because we're trying to treat everyone with a specific condition set. And if we have the data to be able to back it up, to understand that from a clinical performance, these types of drugs are superior for people like us, we can then make it a generic for people like us to afford it, to have great care. And ultimately, I want people to have that feeling of trust that pharma wants to be able to support them, because it's still in a new state, novelty state, where the intersection of digital health and then with the rollout of the initiatives of getting diversity into clinical trials, I think it's started to take shape, but it's still confusing to the everyday patient on the street. And we want to be able to harmonize what that means for them, to be able to have them own their data, to be able to also want to participate freely on their own with trials, so that we can then condition the history of medical research to be a thing of the past. We do know that there's always behavior modifiers that are there that will always change how people feel, but we want to eliminate as much of the ambiguity of is there a chip in this vaccine, or is what's happening here. We want to be able to just eradicate that understanding once and for all.
Mm-hmm. Thank you. It seems like some education here can go miles to helping increase access to care as well.
Absolutely. So the more standard of access of care that they have, the more that they believe that now that they're involved in the process, and the more that they are involved in the process, the more that they tell everyone else in their family and everyone else in their community.
So the problem that we're tackling is that clinicians lack timely and actionable molecular data to make informed decisions. And this is a problem that's been around forever, and it's really relevant for fast-moving molecular targets. So things that, like glucose, that moves rapidly. And the reason this is a big problem is that typically what clinicians do is they take a blood draw for molecular targets. So that's how you do it. And three big issues arise from that. So number one is that when you have something moving quickly and you take a blood draw, you get one data point. So trying to get a insight from one data point when something moves quickly is obviously incredibly difficult. Secondly, to get that data point, there's a lag time. You've got to take the blood draws, got to go to a lab and get processed. And so the clinician's always looking in the rearview mirror, and that hampers critical decision making. That's the second problem. And then the third problem is that sometimes they just need more than one data point, which means they've got to take more blood draws, which is often impractical in busy EDs and ICUs, and definitely in outpatient settings. So these three problems, they permeate throughout the whole healthcare system. And it literally costs hundreds of thousands of lives every year because clinicians simply don't have the information to make these informed clinical decisions. They do the best that they can with the information that they have. So, with our product, we can solve that. And because we can solve each one of those three problems, that means we can actually solve dozens of problems in the healthcare system. And I mentioned one earlier, therapeutic drug monitoring. If you go into hospital and you get, say, a drug like vancomycin, in 36 hours, a clinician typically gets 3 data points. 80% of the time, they're wrong because they've got to be taken within a certain time frame, and they're not. That's why those stats they gave you earlier about 10 to 20% of people get a toxic dose, 60% of doses are outside the therapeutic range. They have disastrous consequences for patients. We measure once a minute in real time, so it's like the clinician, it's like taking the blindfold off. So that's what we're doing, and that's the problem that we're tackling. That's our first market, but there's other markets like we can measure creatinine, for example. So acute kidney injury, chronic kidney disease, they're markets we're going to move into, and they're one size fits all. And I kind of really related to what Narab was saying earlier about prevention, because that's what we're all about as a company, and giving insights. A lot of people are on a path to particular lifestyle-related chronic diseases, and this is somewhere where we want to go as a company. And they don't know about it. And the first they know about it is they go get a blood test, and the doctor says, "Oh, you've got diabetes," or "Oh, you've got chronic kidney disease. By the way, you've been on that path for the last 5 years. You didn't know about it. It's preventable. If you knew about it, you probably could have done something about it. But gee, you've got it now. So sorry. Now we're going to treat the symptoms." That's how it goes. And that's really a shame. I mean, something that is you can find it. You can, if you know about it, you can do something about it and prevent it. That is a window of opportunity that we should be focusing on with massive resources, and we're not. There are 800 million people with chronic kidney disease. 1 in 2 adults in the US have either prediabetes or diabetes. These are enormous numbers, right? These are big problems that are growing bigger, and we're not doing enough to prevent them, and they're preventable. So that's what we're about. There's some of the big seismic problems we see in the health system, and we're trying to have an impact. We're not going to do it obviously alone. We're part of an ecosystem, but the reason that I'm here today is to get this message across, because it starts with that seed, and the more and more people that say the same thing, hopefully we can start to move the needle and actually have a real impact here, because it warrants it. That any rational person looking at that situation cannot say, yeah, just wait for someone to get the disease and then treat the symptoms. That's an insane model, but that's the model we have globally.
Mm-hmm. And it seems like too, of your solution as well is this personalized approach where it's not a one size fit all. It's not 1 gram of vancomycin every 12 hours. We know that doesn't work for everybody. So it's.
I mean, one thing we know more and more is that personalization works. We need tools to facilitate it. That's the thing we don't have, right? So treating everyone the same, which that happens all the time in so many different areas, just gets disastrous outcomes. I mean, it's nonsensical. So, I mean, if you and I had the same amount of vancomycin, for example, we'd have everyone metabolizes it differently. So we're going to have a very different concentration. I mean, imagine you've got a 10 to 20% chance of a toxic dose of that drug if you go in a hospital. So you go in a hospital with one problem, you'll come out with a lifelong, if you survive, that is, it's one of the top 10 killers. But if you survive, you've got a lifelong problem that you didn't have when you first went in. I mean, that's 10 to 20% of people. It's a huge number. So there's 6.3 million Americans get dosed with vancomycin every year. So the numbers are staggering, when you really sort of look at it that way. So yeah, it's a big problem, and there's a lot of upside. So maybe that's the light that we can improve this, pretty significantly.